I'm with Steve Hayes. Hi, Steve.
Hello, good to be with you again.
So we're going to talk about process-based therapy, and which means a lot to you. And so maybe let's just jump in.
Okay, let's do it. Well, you might say a process-based approach would be a little softer way because as soon as you say therapy, people think it's a kind of therapy, and it's not. It's a different way of thinking about what we want of the art and science of therapy, intervention science more generally. As soon as you say psychotherapy, you pull hard for idea of disorders and things like that. So I really mean things that empower people to help them live the best lives. And the fact is that we have a lot of real problems here. We're not progressing properly. The lower and middle income countries are ignored instead of the weird world. We've turned this whole science process into a way of doing things that cuts out the practitioners and the people worldwide, but also is leading to actually lower or flat uh, impact over 40 and 50 years. Um, I think we've been proceeding in a way that builds walls instead of bridges, and that doesn't connect the intervention work that we do, whatever you call it, whether you call it a mindfulness retreat or psychotherapy, with the best of our cultural traditions, our wisdom traditions, our art, literature, and so
So,
on.
so let me just
So,
slow down a little bit because
yeah,
essentially my question say I say process-based therapy, and already in the question, therapy brings it into a certain little niche,
yeah,
and so you bring up the notion. Well, let's look about interventions that help people lead better lives
yes,
instead of just pigeonholing it into that category.
exactly.
And then let's see of what's happening. And you're saying, there's a context in which when talk about therapy, we just talk about a few countries, and there's a larger universe, a larger number of people who could be affected, and the problems that exist with the way we do things right now.
Exactly. And many of these problems are going in the wrong direction. Young people are suffering even more, even though the world is prospering in terms of you're less likely to die of disease, you're less likely to die of hunger. Violence is actually going down, not up. I know it's on our screens. I know we think it's not true, but it is true. We're progressing in every single area except the one that makes the most difference, the
Yeah.
one that leads us to happiness, satisfaction, etc. And with what's happening with AI, we can see another future like where it's even scarier in that way. And we need to be part of that. When I say we, I mean the behavioral scientists and those who are trying to do the work, whether you call yourself a nurse or an OT, a PT, a teacher, a business owner, a workshop leader, a psychotherapist, a physician, you're a change agent. So what process-based therapy does, or process-based approach, is it pushes the reset button for really important reasons that are becoming more important, not less, as we go down this journey. We're discovering, for example, that our basic scientific assumptions, analytic tools, and measures are wrong, fundamentally wrong, and they can never be made right. That's 5 or 6 years into this journey.
So let's talk a little bit more about that notion of our systems of measure, our benchmarks, our metrics don't work.
Well, a quick way to get to that question was to say, well, okay, so what is psychometrics, group designs, t-tests, correlations, all the things you're used to, psychometrically validated instruments, etc. What are they based on? Well, they're based on a particular statistical approach that's 150 years old. The people who developed the assumptions that led to that, what were they professors and scientists of?
Hmm.
And I ask this question to you. Do you know the answer?
Math?
You would think, right?
Yeah.
Statistics?
Yeah.
No. The answer is eugenics.
Wow.
That's a fact. R.A. Fisher was a Fisher Z, professor of eugenics. Carl Pearson, Pearson's R, professor of eugenics. The standard deviation created by Galton, the creator of eugenics. Frank Yates, the Yates correction on a chi-square, a eugenicist, and on it goes.
That sense of, in a way, instead of being a scientific instrument independent of anything, they're actually part of a mindset that was
Exactly.
going a certain way.
Exactly. And I'm not playing cancel culture here. I'm not saying, Thomas Jefferson owned a slave or something. Yes, of course, history moves on. People have sensibilities. No, I'm saying the tools were developed for a purpose based on a set of assumptions. And at the same time, other scientists who had different purposes and were behavioral scientists came to a different conclusion and built different tools, which has been unknown to us in the behavioral sciences and psychology until just the last 20 years, and only really well known until the last 10 years, but it's still not landed in our methods. So we've built a castle on sand, and when we look down, it's dirty sand. It's filthy, dirty sand. It's racist, it's anti-Semitic. It was there for a purpose, which was to decide who should have children. And we saw where that led after many decades, mostly in the US of A, not Germany. We wrote the laws with the help of who? Psychologists and psychiatrists and medical doctors. That with the help of them, word for word, those laws became the laws in the Third Reich. And then after the Second World War, everybody ran away, but they didn't stop doing what they were doing. They stopped using, they were still using the same tools for the same purposes. It's still all about bell curves. And now we got a world in which your 6 year old or your 7 year old knows what your percentile rank is in school. And we think that predicts their future. No, friends, it's mathematically impossible that it predicts your future. And the physicists knew this in the 1880s.
So it
So,
reminds me of that scene in The Brave New World where you have the baby factory where they're on different tracks. You know,
right, we have been tracking people and
yeah.
we've been diagnosing people we think so that we can help them. Well, read the beginning of the DSM where it says, by the way, this is not known to improve outcome. Don't use it to select treatment. Do you know it says that in the beginning of the book?
Yes, yes.
Yes,
I mean,
that's the
only when
honest,
you remind me, though, only when you remind me.
that's the
It's like when you tell me, I remember that I read it somewhere but forgot it.
That's the honest statement of the ICD and the DSM, which you're required to use. You have to genuflect in front of this, or you can't even get paid as a psychotherapist. And in some parts of the world, you can't even have so much as an app to help people unless you first genuflect in front of that holy book, which is scientifically false. It's wrong. And by the way, dirty. If you take the earliest diagnosticians, let's take Bleuler, schizophrenia. He invented it. Most of us would know that. Read his 1924 textbook on psychiatry. And I'm paraphrasing a little bit, but it's almost word for word. The more severely affected should be sterilized because we should not bear the burden of this disorder in the gene pool.
Mm,
Boy, and how about IQ tests? Same thing, down to actually fraudulent data and deliberately suppressing data that showed that IQ is flexible. Over and over and over again, for 150 years, we've been trying to select who's worthy instead of empower everybody.
right, right,
So,
right.
what you're seeing with our narrowing and ineffective, or not known to be progressive empirical base for the work that we do as practitioners, as psychotherapists, and so forth, what you're seeing is a reflection of incorrect assumptions built upon purposes that don't really fit our use case. The
Yeah.
math is correct.
So,
The
so
math is
uh,
correct.
let me try and say it to summarize that. It's not just that, say, the method itself, the test, has flaws. The test has a bias that following it brings you to the result of a certain ideology, as
Exactly.
opposed to being a neutral instrument.
Exactly. It's in our language. It's everywhere. And we've socialized the whole world. So it's now even in our children's language about themselves. And then we have the sad situation of young people coming to us with more suffering, more suicide, more difficulty among young people than ever in the history of the world. And they say, I have this and this and this and this and this, and there's six things. I'm unique. Because the only way that we can tell them about how unique they are and how to grow and prosper from where they are and who they are and become more fully their true selves is to use these horrible labels with a dirty history in many, many, many ways. It's because there's no other language for it. Smart and dumb, ADHD or not, neurodivergent, normal, etc. Like little cuts in a bottom of a
So
gun.
you exist only to the extent that you're put in a certain scale. Uh,
Yes.
and so you look for identity, but the way you have identity is put in something that is actually very damaging.
Yeah, because you've been socialized to do that.
Yeah.
But how about the language that allows us to see our uniqueness, identify what is pushing us down and lifting us up, and working with professionals, target the things that are swirling us down or building the things that move us up.
And
And so,
so that's where when you describe it this way, it's a shift from a category to a process,
exactly,
understanding the way I function, what
exactly.
brings me up, what brings me down, instead of here is where I belong.
And that's what process-based approach or process-based therapy. I, I'm worried a little bit about the term because immediately
Yeah.
people think it's a new therapy. It's not. People have been doing this from the beginning. Who? Clinicians. And some wise scientists, but not too many. And the vast majority, especially of evidence-based therapists, are being told by their supervisors, you have to do it this way. And then they see those smooth curves in the journals, and they get in their consulting room and they see a bowl of spaghetti. And they're told, don't believe your lying eyes. What's really true is what's in the journal. No, the journal is actively lying to the
Mhm.
researchers who don't know they're being tricked and to the clinicians who are looking for those smooth curves and don't find them anywhere. So we're going to have to push a reset button, say enough is enough, and build from the bottom up. And all we mean by a process, nothing spooky, the small things that you can do. Uh,
So maybe that's what let's go to the from that very spooky part.
yeah.
Some of the small thing that we can do that we already do that people who are don't think of themselves as process oriented already do,
Yes.
and the differences between that and something that's not.
We looked at every successful study ever done in the history of the world that looked at any psychosocial method for any kind of mental health problem that identified the process by which or the path that was followed for people to improve or not. And we've been able to summarize all of that into one single sentence, and I can tell you what it is.
Yeah.
Life is asking you to learn to be more open, aware, and actively engaged in a meaningful life while applying that to your relationships, culture, and your body. Put a period on the end of it. And that's what the deeper clinical traditions have been doing from the beginning. And if we can come together in community and stop building these walls and my hero is the right hero, my words are the right words, but instead are meet in community, speak the way you speak, but then recognize that you're targeting processes. You're asking your clients to take small steps in some way.
So would you maybe repeat that sentence slowly so that we can just
Yes,
kind of sink
and
in?
I can unpack it into about
Yes, yes, please.
8 things, but I'm going to give you in a way that only has five. You need
Okay.
to learn to be more open, more aware, and more actively engaged in a meaningful life while scaling that to your relationships, culture, and your body. Relationships and culture really are two features of the same thing, but
Hmm.
scaling that socially and physically. So that's five things: open,
Yes.
aware, actively engaged, relationships, and your body. It's not so complicated.
The phrase you mentioned does not go into any sort of diagnosis, but goes into what to do
Yes.
and in a way, rules of engagement.
If you meant by diagnosis simply having a way of speaking about what's bringing you down or lifting you up, you can say it's a diagnosis. It certainly is a case conceptualization.
Yes.
From the tradition I came from, they'd call it a functional analysis. But that's the deeper clinical traditions have always been interested in understanding the particular person or couple or family in front of them. They've not been interested in sort of generalizing to some random sample from some population where everybody's thrown together in a heap. Think about how crazy this is.
Yeah, yeah. But so that's interesting because the need behind it is the notion of what understanding is to be able to classify. So
Yes, compared to
uh,
others.
I want to know what the universe is, and this is how you fit in these categories. As opposed to I want to understand you, meaning I want to walk in in your shoes. I want to see things from your eyes. I want to see how you function. And
Yes, I'm with you. The kind of understanding we want as clinicians, I think, is to walk in the person's shoes enough, but also have a way of parsing what's going on there in a way that I can center in and say, this is what's most important that would lift you up. Or this over here is really pushing you down. It looks like it's helpful, but it's not. And let's work another way of handling that within your life over time. Clinicians have been doing it from day one. They notice a good clinician. Hey, wait a minute. How did I get talking about this? I didn't mean to. And you mentally go back and you say, oh, I raised an issue of sex. And then it changed. And now I'm talking about your work stress. What happened? And then a couple sessions later, it's, how did I get? Oh, I raised the issue of sex. Ding, 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 ding. I have a winner. You know, you have an intuitive sense. And this is not so spooky and it's not so real. It's special if we'd spent the special time and to be trained in psychotherapy in a process-based way, and our better traditions do that, unhelped by science, usually actively harmed by science. But we all know it because if you have a good friend who walks in the room and you look over, something's wrong. You know it from across the room. We've actually done studies on this. I can explain what's happening there and fit it to open, aware, and actively engaged. But so we're all doing intuitively, and the scientists are telling the clinicians, no, 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 you can't do that. If you're going to be a science person, you have to do this. And you're going to fit people into bell curves and standard deviations and Galton's eugenic dreams.
so let me try it in a different way. So, in a pragmatic way, as a process-oriented therapist or
Yeah.
helper, or uh, essentially, I get absorbed into the client. And there is something about, being very interested in the client, trying to see the client through their eyes, but aware that I'm also a different person, so that there is a back and forth between being aware of myself, being aware of the client. It's like something happens there. And in something that happens, I get involved both in the process of the client, the way they are in the session, the way they are in their lives. At the same time, I'm aware of my own process, including the way I perceive the client, the way it evokes things from me, and so on. And so this gives ideas that emerge. And from these ideas, there is a testing in a way by either saying something or doing something or recommending something. And so that's essentially the process of what happens in therapy is process.
It is, and I want to add one thing, and you'd agree, I'm sure. It's from it, toward it, and with it. So if it's learning how to be open, aware, and actively engaged, scaling that to your relationships and your body, well, the therapy is a relationship. And if, you know, we probably have all heard things like, don't do what I do, do what I say from our
Mhm.
at their worst. Of course, children don't do that. They do what they see. They're going to imitate no matter what you say. Well, if you're in there, you have your own processes. You can see and you're targeting processes in the client. If the betweenness doesn't contain and reflect those processes, you're wasting your time because if you ever start saying things like, you shouldn't be so judgmental, just shut up, because you're actively putting judgment into the betweenness. You may not mean to, but you are, and of course that will be harmful.
Yeah.
If
Yeah.
when the sex word comes up, you run away, your client will see that and they will save you from that at the cost of their own therapy.
Yeah, yeah. And so the beauty of it is actually if that happens and you're process oriented, then you take it as, oh, what just happened? And maybe does it have anything to do with what I did, or how could I do something different to change it? And so it stays in process as opposed to being an issue that has to be resolved by reference to some kind of encyclopedia.
Exactly. And I think the best of our clinical traditions, the deeper clinical traditions, have always done this. The problem is if it's only done by art,
Yeah.
it has a hard time being progressive. Are our modern playwrights better or worse than Shakespeare? The usual question. It's very hard to know if we just consider it as an art. Are our modern physicists better than the physicists of 200 years ago? Unquestionably. Unquestionably. Not even close. Not in terms of their basic, ability to learn or things like that if they were updated, but we don't have classes on phlogiston anymore. So how do you you want a field that's progressive, I think, now knowledge is always on a arc. We're never at full and adequate knowledge, but we should have some idea. And, I can say a little pridefully that the ACT work has more data on how it works than any other approach in
Hmm.
psychotherapy, in my opinion. And why? Because we always wanted to be a process-oriented therapy. I never cared about the name ACT. I never defined it as a technology. You can't find me saying, here are the ACT techniques. I don't care about that. Yeah, we'll invent some techniques and borrow and steal and beg, take for any techniques. Use your best techniques. Use the things you really like. If they move the processes, it's in writing long ago. As long as you're targeting psychological flexibility, which I can now say in a broader way because it includes your relationships in your body, and in a more precise way, learning how to be open, aware, and actively engaged. If you're targeting that and you're held accountable to that, you can take what you do and call it ACT if you want to, or don't. I don't care. Call it psychoanalysis, call it schema-focused therapy, call it emotion-focused therapy. I mean, I respect all those things. Some of them I especially resonate to, like emotion-focused therapy and so forth, even though, yeah, because they come out of the same historical roots. That's another story. But, you know, when we do that, people can come together in community, not feeling as though they have to check their mind at the door in order to be able to talk to other people. And we can talk about processes and have a language that links us without having a language that forces you to change the way you think, the way you categorize, but allows you to sort of check in on what our measures are allowing us to do now that we've escaped Galton's
Yeah.
greedy, dirty hands.
So,
And
so essentially, the meeting room, the invitation is okay. So let's actually talk about what it is that helps people be open, aware, engaged,
yes,
and what you notice when they are, and what you do when that happens. And so, but so that's the place. That's a meeting place. That's a place where it's possible to build bridges.
exactly. And
And so that's also that notion of process, because it's really the process by which people can process life and make sense of it and learn from it.
exactly right. Exactly right. Word for the way that I would say that. And when we meet in that way, what I find with people around the world, even though they know I'm an ACT person, and initially they're kind of maybe a little cautious or afraid I'm going to, try to, sing a song of ACT über alles or something. What the process-based approach or process-based therapy has allowed us to do is to really come in with more of a clean hands. How do you deal with issues of people being open or closed? How do you deal with emotional openness or cognitive flexibility and openness or rigidity? How do you deal with attentional flexibility or rigidity? And so on it goes through that formula. How do you focus on what the person's particular values, what they really want out of life that are intrinsic to what they do, and build habits around that?
Right. And so these are questions both in a way to the client from the therapists who are interested in that, and to therapists to each other in terms of I want to learn from you from your experience, not in terms of this body of knowledge is the right one, but expanding on the repertoire of how to deal with that. And so there is a similarity of focus on what the client and what the process of helping the client.
Exactly. And when you do that, the entire world has a stake. We've been trying to build evidence-based therapy on the 12% of the population that are Western educated, industrialized, rich, and democratic, so-called. We'll see. Yeah, that's 12% of the world's population. And they have very, very different ideas. I've spent a reasonable amount of time meeting with the knowledge keepers of Indigenous peoples in Canada and their view of values. I'm beginning to understand. It's very hard for me to explain unless I have help from a tribe member or so forth, because it has to do with things like the voices of your ancestors and respecting them, or what Mother Earth is saying, and how to be with that, and things that, my Western mind didn't think that way. We need that in our science, and we can do it. We've actually trained through AI, large language models, to take transcripts, and person by person, we can begin to see their particular way that they think about their values, for example, even if it has nothing to do with some list of virtues that somebody in positive psychology said, these are the virtues. Come on, those are the ones that are in your culture, friend. That doesn't mean those are the virtues. Ask people, listen, be more humble, and then allow people around the world to participate, but especially cool at the practice base. This will never be done in the academic medical centers. It just won't happen. So the only way that we can create a field that really is progressive, empirical, and worthy of the challenge of the human condition is by reaching the people who care and are trying to change the lives of people. And I think that's a windmill worth tilting.
Yeah,
And
yeah. And so essentially, it is to be more conscious of that approach, to say it's not about you need to change your programming, that you probably already do it in some way, and try to notice where you do it versus where you don't. And maybe just remembering that notion of open, aware, engaged. And how do you notice it in clients, and how do you notice it in yourself, and what do you do about it?
that's such a wonderful comment, and it's so true. If you start collecting measures or having them collected for you, if they're wearables or scoring of behavior or transcripts, and you look over time, there's all this variability within the person. If I give that, and I have a not-for-profit app, so I have no COI for this one. I do for-profit as well. It's called Mindgrapher, out of a charitable organization I'm president of called the Institute for Better Health. And what it does is it takes ecological momentary assessment data, but then puts them into some of these modern statistics that we're calling idionomic, which is our word for as a replacement for normal. Idiographic as the basis to try to get to general principles we can apply. Nomothetic, idionomic. Okay. Well, when you look over time of anything, people come up in and saying, "Oh, I'm so like this, etc." And even in the categories they use, I have major depression plus BPD, and my doctor said I've got a PTSD with the big. You have this list, often backed up by lots of medications, which really create all kinds of other problems over time if they're used high dose long term. Sure enough, here are some days where, by golly, the person's doing pretty well on this measure, but they forget the very next day. It's not only is it gone by what they do, they forgot that it ever happened, that it wasn't always like this. But you have that friend who's following you around and doesn't ever lie. There it is. You said today this was happening, or I saw
So,
today.
so I want to do, in some ways, when you were talking about the friend that follows you and you brought the phone, um, I took it as a metaphor. But what you're saying is there's actually a value in having a record of it,
Yeah.
because the record is what's going to remind you that the construct of your mind is you're always, say, depressed, but actually you want to see that it varies. And so this is a way of making you remember that there is a variability.
Yes, and you forget the details. Oddly enough, you know what I'm saying. Every person listening to me now knows what I'm saying, and I can prove it to you in about 90 seconds. You want to give me a chance?
Sure.
Okay, pick up something that's really, really hard psychologically, been around a long time, really difficult. Okay. If nobody's around, great, because then you can do it. If somebody's around, you can do it in imagination. Put yourself, your body in a shape of you at your worst when dealing with that issue. And when I say in the shape, I mean as if it were a sculptor, and if it turned into brass, somebody could walk by and have a clue about what it's like to be you inside when you're dealing with that issue at your worst, whatever that means to you. Take a little mental picture. When we're doing this in research, we actually take a picture.
Hmm.
And then we take the same instructions I'm just saying, we say to the person, now, the same issue, don't change it. Find a time where you at your best. It isn't always like that. At your best, it may not be as best you can imagine, but what you've actually lived, you at your best, and put your body in a shape that expresses what it's like to be you with that same issue at that moment. And then if you're doing it by listening to me, take a little mental snapshot. When we're doing it on research, we take another picture. In the research, we then scramble it. So now we have hundreds and hundreds and hundreds of pictures. We grab people and we say, look at this picture. How open or closed is that person posture? How aware or unaware is that person's posture? How ready for active engagement or disengaged and not ready for active engagement is that posture? We don't train narrators. We just grab people off the street, say, rate this, okay? Of course, both pictures are in there, but there's so many hundreds, they don't know that, oh, I saw that one before. It's all scrambled. Here's what the results show. Number one, surprising fact. People out there can do ratings about open or closed, aware, unaware, at levels that are to die for if you want behavioral ratings of anything. In
Mm.
other words, everybody on the street, that's why you, from across the room, you say something's wrong. I mean, you're leaking like a sieve. If you're struggling and walk out, you better put a bag over your head because everybody knows it. They just don't know that they know it, but they're sensing it. And if I ask you to rate it, they'd do it. But here's the other thing. Massively more closed, unaware, and inactive at your worst, massively more open, aware, and ready for active engagement at your best. And 95% of everybody we can find on the planet, we've done it all around the planet, show the same exact pattern. And the few exceptions are things like Islamic males who adopt a prayerful pose at their best that gets read by Western raters as being closed. There's a few exceptions. It's very small. Look, what this means, we all know it, we live it, we know it because we lived it, but this organ between our ears does not know it.
Okay.
Because
So,
once you,
so let me just kind of put it in my own words. So that sense of um, paying attention to really difficult moment where you perform at your worst, and the body picture that you then have or represent um, is actually something that's the unity of the person. That it's not just, when we're our worst, when we're reacting to life, when something is really intense, it's not just an idea, but it actually is a whole body thing.
the whole
And
body,
so, the more intense it is, the more it's pronounced. So no wonder then, in a way, the reading, when seeing it, you may not know what the issue is, but you really know that this is something where the person is the least likely to be open, to be aware, to be engaged because it's under tremendous pressure, threat that's destructive.
I reached back as one of my students gave me this picture. It's called Suffering Buddha. It's just a little wood carving. You've seen it
Um,
before.
yeah,
You at your worst, this is a pretty good representation of it.
yeah,
Is that open? No. Is
no,
that aware? No. Your eyes are closed. Is that ready for active engagement? No.
no. But so,
Conversely, when people are asked to be more open, their head comes up, their eyes open, their arms and hands go out. They sometimes even raise their hands. Their feet might go apart. And sometimes people walk around. I'm
yeah.
ready for active engagement. I'm here. I'm ready. Okay. So we know it in our hearts, but we don't know it in our heads. And therapists learn to read it and pursue it and ideally put it in the betweenness. But the scientists are horrible at being able to take their measures and track that properly because they've been trying to do it in this one size fits all bell curve way. And we're,
But also because it's going into trying to find the mechanism to the issue. But the beauty of this is actually it sidesteps the issue. It's about how your whole self
Yes,
is organized. And so the issue itself is, in a way, almost irrelevant. Of course, you need to deal with it, but the point is, it's not so much dealing with the issue as if it were separate, but dealing with the intersection of you and the issue. And so that's where you come back into the process.
exactly. Well, and then what that says, if I can say how important this is, clinically, the things that move first are these kind of things, so you get better feedback, number one. Number two, just as you say, some of these same processes are showing up in other areas. And I ask, uh, let me just give you an example. I ask psychotherapists this all the time. I say, what kind of work you do? And they say, oh, I work with anxiety, I work with depression, I work with personality disorders, and they have a list. And they say, when's the last time you treated tinnitus? Most of the room going, what? I say, you you know what it is? Yeah, ringing in your ears. Do you know that about 25% of your patients have it? Okay. Do you know that something like 15, 20% of those, it's the worst thing in their entire life? And they didn't even tell you. Why not? Well, I don't work on, I'm not an audiologist, friends. The audiologists don't have anything to give them. The ringing is happening to about that, I'm an old punk rocker. I have ringing in my ears. I ain't going back and not listening to tatted up, leathered guys screaming like an aircraft engine. I did that. My ears tell me that. I'm 76 years old. It rings from morning till night. And it wasn't until I finally, after a 3-year struggle, had a suicidal thought that the thought came to me, maybe you should apply your life's work to it. And it solved it in a long walk. And it's turned into randomized trials, measures, etc. My point being, you're not asking your clients about a lot of things, the pain in their foot, about maybe, probably you're asking about their sleep. We didn't used to. I'm old enough to remember when nobody asked about sleep or exercise or what they ate. Now everybody says, "Oh yeah, I do that." If you are onto the most important processes that involved on this negative side and the positive side, it turns out, if somebody wants to run a marathon and they're working with you on depression or something, you don't have to just work on exercise for the depression. You can help them run the freaking marathon. Because what you're dealing with, what you're moving to deal with the so-called mental health problems are life flexibility processes that will empower them in their relationships, their work, their sports performance, whether or not they can go to sleep, whether or not they can deal with a cancer diagnosis, on it goes. So why are we slicing people up into little pieces and saying, we just work on these mental disorders? We're back to Galton's eugenic dreams.
Right. But also, there's, to be charitable to the idea of why we're doing it is because, okay, so I want to focus on an issue that I have some power over. But
Yeah.
essentially, in doing that, you're ignoring all of the other stuff that makes a person who they are. And it's not because you cannot see an issue that it's not there, but you can actually address it when you pay attention to the process that the person is. And so if you address the process, then in a way, you make it possible for the issue to get solved through the
Yeah.
process.
So our intake forms, I mentioned the apps we're doing. Our intake forms look like old behavior therapy. It asks them about everything. Why? Because I think while you don't have any expertise, let's say in tinnitus, okay, but with just a little bit of reading, you can see that, oh, by the way, these things that have helped you so much in our work here. I see here that you say they have ringing in your ears. Is it still distressing to you? Oh, very, very much. Do you know that these same processes can really be helpful over there? I can get you a book, an app, or we can spend some time here working on it. Oh, that would be such a thing. I went to the audiologist and they told me to do this and wasn't any help. And they said I can't do anything and there's no operations. No, there is help. And it's right inside the same thing that we've just been doing. It's just that our field has been dividing people up so much that you don't realize that what your mind knows how to do can apply to how you deal with ringing in your ears or the pain in your foot or, so look, we say mind body. Do we mean it?
Hmm.
If we mean it, it doesn't mean arrogance. It doesn't mean don't tell people to check with a physician. In this case, there is a very rare cancer that can produce tinnitus. Yes, you should go and have things checked. And some of the very best treatments that we have for dealing with things like, post-surgical pain or things that we have nothing to do with is everything to do with it. It has to do with bringing our mental flexibility to yet another challenge. And if we're not about that, lifting up people in their lives, then what are we about? And why are we narrowing down our practice only to a list that's in the DSM?
Yeah, yeah.
Chronic, chronic,
Interesting that you talk repeatedly about the notion of brain flexibility, and so very much uh, opposite in a way or different from the concept of strength. You have to strengthen this, like that concept of muscle and so on. That notion of flexibility.
yeah. Yeah, persistence can be important, but the strength thing, strong and weak, so dominates that we think that we can just grit our teeth and tough it through, and that may be the exact opposite of the thing to do. And I'll give you an example. You take something like panic disorder, you know, men especially, it's gender typed, especially try to white knuckle it and just, don't tell anybody, blah, blah, blah. This is a toxic formula. Boy, if you really want panic disorder to stick and stay, do that. Oh, I read somewhere that exposure will do it. You're looking at a panic disordered person in recovery, and I did that. And you might as well just spit into a hurricane to do that. It actually makes everything worse. So a lot of our mental models have been built around concepts that don't apply within the person over time. And so I do want persistence, flexibility, endurance, etc. You can use that metaphor of the body, but let's not do it in a way that tells you that you just have to kind of tough it out, grit, all that kind of stuff. There's something in there that's important, but I'm back to open, aware, and actively engaged.
So maybe let's, as a way to conclude this, let's kind of repeat that phrase, that's as a way to, or anything else you want to add to it, but some kind of a very simple summary of the attitude we want to foster.
I think life is asking something of every single one of us. And if I can be afforded just a little minute, it's in all our great literature, all our great stories, etc. The reason why we like those stories is we can put ourselves into it. And that, yeah, we start off feeling inadequate to the task, when the droid shows up and says you have some special thing to do and you're just out there in the middle of the desert or whatever. And initially you feel overwhelmed in terms of, I'm not up to it. You have difficult thoughts and self-doubts, fearsome feelings. But if you can come into the present moment in a way and ally with your friends and with your strongest sense of self, you can turn towards retrieving the golden fleece or putting the ring into the crack of doom or, confronting Voldemort or whatever the particular story you connected to. We're on a hero's journey here. You can focus on your values and what you want to be about and with your friends and actual behavior. Take steps that do something, and then the cycle will continue with the next challenge. So, the simple statement that would be life is asking you to be more emotionally and cognitively flexible, to be more aware in the moment in a way that's flexible, fluid, and voluntary. And then take those mindfulness skills and applying them to what brings meaning and purpose to you intrinsically and creating habits that puts that into your life. So even when you're not monitoring it, you're sort of accidentally pursuing that values-based journey. And by the way, you're a social creature, so don't forget that friends matter, your relationships matter, culture matters, and you're a physical being too. So if you're not taking care of your body, it's not going to take care of you. It's not that complicated of a statement to say, but no
Hmm.
matter how much you work on it, you're going to have more to work on it Nobody's ever going to get the gold medal and the final prize. It doesn't work that way. But no matter how big you get, there's bigger to get. And at the edge, your mind's going to say, "Who, me? I'm not adequate. This was too hard." And it'll do all those tricky things that you worked out with challenge after challenge after challenge. Okay, let's do it again. Start again. Beginner's mind. Can I own up, show up, step forward, and holding the whole of my experience, take my life in a direction that brings meaning and purpose into my life and to those that I love and serve. So that's a wonderful life journey.
It
And
is. It is.
once you're onto it, it's a lot
Yeah.
of fun and it's a big challenge and it's not going to ever stop. And our job as therapists is to help people own up, show up, and get moving. And we can do that by getting them out of that mindset that they're broken and they need to be somewhere else other than here before they can start.
Thanks, Steve.